Okay, so today we're going to look at a couple interesting teaching cases. This patient only came just to check size versus state. So this is a standard obstetrical sonogram governed by the AIUM ACR ACOG guidelines of what you need to look at. And of course, in there is the spine.
Okay. So the initial picture looks like there is some abnormal vertebral bodies. Basically, here's the sacrum. So this is probably in the lower mid-lumbar spine, I'm going to say.
Okay.
Abnormal looking vertebral bodies.
And what do you observe in this picture?
Well, you've got sort of normal looking vertebral bodies, and then you kind of don't see one here, and then you start seeing them again.
That is correct. There's a gap here. Okay, that's an important observation. And just as these vertebrae are supposed to line up, the vertebral bodies line up posteriorly. To a large extent, these should look similar. So these are the laminae.
Sure.
And you can see that these laminae just don't quite all line up there.
Okay.
This is seen, of course, much more readily in a real-time picture.
Right.
Okay, so your observation is correct. So I always let my eye flow along this line of the dorsal aspect of the vertebral bodies. And when you get to here, they just...
The dorsal aspect, not the...
That's
both.
The one I use. You could
Okay.
use either one, but because you're getting some shadowing of the downside,
Oh, right, sure.
you're better off using the dorsal side.
Okay.
So
Good
here
tip.
you can see they're just out of line. Okay,
Right.
That means a segmentation abnormality. And here again, in this cine clip, you can see that these things are not lined up appropriately. This one's size, that's the one that dropped out. So there is part of a vertebral body there, and part of it that isn't there. So you've already drawn a conclusion?
Which is there's abnormal vertebral bodies or a segmentation abnormality.
That is correct. These are segmentation anomalies of the vertebrae. They're reasonably common. They are things that you will run into on a standard obstetrical sonogram.
I think they're pretty, well, I think in general they can be fine.
That is correct. If they are isolated, they usually do quite well. But remember, these can be associated with syndromes.
Right.
So this definitely, once you see it, it definitely requires a referral to a prenatal diagnostic center where they can discuss with the patient and look for some of the associated syndromes that are known to be seen with this. Now, as everyone I'm sure is familiar, there are many types of these things. But fortunately, the one that's probably the most important in subsequent management issues is the one that we actually tend to see best. And that's because hemivertebrae most often are the ones that cause the spine to go out of kilter.
Right.
Okay? So it will either produce...
This is the hemivertebrae.
That's correct. And there's various types of hemivertebrae.
These we see all the time on x-rays in 60-year-old people who never knew they had it.
Exactly. But the hemivertebrae are the ones that will bend the spine around and create a variety of issues in terms of either kyphosis, scoliosis, or increased lordosis. So these are also the ones that are most likely to cause a neurological problem. So for good or for bad, although there's a large variety of these things, that's the one we're going to have the best shot at seeing. And most often, these have no symptoms associated with them, so they're treated conservatively. And the ones that are symptomatic or are creating a significant scoliosis can usually today be managed nicely by either spinal cord decompression, if there's neurologic symptoms, and vertebral stabilization.
Okay.
So I say these are the points to take away. remember that these are part of the Vactorel syndrome. They're the V in the Vactorel syndrome. What are the other letters?
So vertebral, anal, cardiac, TE fistula, renal, and something.
Limbs.
Limbs, okay.
Right.
Limbs.
And these are usually limb reduction abnormalities
Okay.
of one form or another. So while you're looking, remember, you have a straightforward chance of looking at the kidneys, the stomach, and the distal extremities. So that's something you can do. So again, I think if you see a vertebral anomaly of this nature, you're going to refer it, and you can say referring because of vertebral anomaly.
Sure.
But if you see an abnormal missing kidney, for example,
Just look
or
more
an empty
closely.
stomach,
Yes.
you sound a lot smarter saying Vactorel syndrome. How bad is it?
Right.
So, and the other thing to remember is that you're going to recommend an echocardiogram, even if everything else appears normal. Okay. And also, although anal atresia is part of this, I would say that more than 90% of those are going to be missed even by the most experienced examiners. So you don't actually completely ever exclude the Vactorel even after you've gone through your whole
Right.
thing.
So are you pretty much finished?
Yes, I am.
So this just came up the other day. A sonographer said, well, I usually look for the anus and I usually see it. And I thought that excluded anal atresia. And I kind of said,
Okay, that's a good point, that looking actually for the anal dimple is something that I would do being sent a patient for the Vactorel syndrome. And if you have sonographers that are sufficiently sophisticated to look for that, great. Again, my experience is that we have not done well at diagnosing anal atresia.